Hello, welcome to this week's session for Sustainable City Ecologies. My name's Anna Hawkins, and this is just a quick introductory presentation for the theme of this week, which is human health and well-being in relation to spatial master planning. So the themes I'm going to cover this week are the socio-cultural determinants of health, green and blue infrastructure for health, mobility and modal choice for health, healthcare infrastructure, and food and health networks. And these are just things that I invite you to think about in relation to your assignment. So one of the things that we're asking you to think about is a health network for your proposed site. And so these are some of the things that you can think about in terms of how you're going to cover that. Now, they're not all things that you have to do, so I'm just inviting you to sort of consider some different approaches here. So the first thing I just want to do before we get into some of the more specific examples is introduce you to the idea of this social determinants of health. So this is really the kind of what underpins some of the rationale for bringing together spatial planning and concerns around health. So it's not anymore that we'll be covering health care infrastructure. It's not just about is there a hospital, is there a doctor's surgery, is there a dentist? It's also about addressing what we know are some of these kind of socio-spatial determinants of health. So these include things like people's economic stability in terms of their availability of employment, the quality and the provisions within their neighbourhood and physical environment, which is probably where you're primarily going to be looking, their education, their access and availability of food, their community and social context, and their healthcare system. So you can see from this that there is actually quite a broad and holistic range of measures that we now know are determine people's health outcomes. And when we look at things like differential demographic data for areas, and we see sort of huge inequalities in terms of health outcome, it's often to do with a lot of the intersections of these different issues. So maybe poor quality housing, high unemployment rates, so higher levels of economic instability, a lack of access to decent quality food, poor education attainment within the area, and maybe also a lack of kind of community infrastructure. Another way of looking at this idea of the social determinants of health, and to maybe think about it in a little bit more in terms of the lifestyle of the neighbourhood and the ecology of the neighbourhood. This graphic here kind of helps to illustrate that. So there are, starting with this central, the red circle in the middle, there are sort of the factors that are determined by the individual. So your age, your sex and gender, your sort of your individual personal biology in terms of your genetic inheritance and all those kinds of things. And then moving on from that, there are the individual lifestyle factors that can impinge and determine people's health. Beyond that, then we have the social and community networks. So we're starting to see how some of these kind of these health determinants can start to actually map onto more kind of spatial scales. So social and community networks. Beyond that, then things like living and working conditions, and this is really where spatial planning and master planning can start to have an impact. And outside of that, the sort of general sociocultural environmental conditions in which people live and work. So this again just kind of shows that people's health it's not just to do with the choices that we make as an individual. It's also to do with the infrastructure, the social, economic, community, environmental infrastructure within which we live. And these are all things that that planners have to think about increasingly. So some of the reading that I've given you to look at really maps out the kind of historical relationship between people and place and health. And if you did planning theory in context last year, then we did a session on place and health. I'm not sure whether that's happened this year in the module, but you can read a lot about the kind of the evolution of planning as a discipline in terms of its role in relation to public health. But jumping straight into kind of where we are on this module in terms of master planning, one of the things that you can think about is kind of double counting a lot of the things that you're already thinking of including within your spatial master plan. And that would include things like the blue-green infrastructure. So you would already be thinking about the blue and green infrastructure, and you might already be thinking about that in terms of environmental health, also in terms of the kind of livability of the neighbourhood, maybe in terms of things like the transport networks of the neighbourhood. So what I'd also invite you to think about is how blue green infrastructure, the quality, the availability, the accessibility of the blue and green infrastructure of an area has an impact upon health in a number of different ways. And again, I've included some reading in this week's learning materials that's specifically about the relationship between green infrastructure, public space, naturalistic environments and health, and really sort of tracks the different ways in which health and place intersect in relation to green and blue infrastructure. But some of the ways that, you know, this visual here that I've included would kind of show that what we're trying to do now increasingly when we're thinking about greening cities is moving away from that kind of the industrialized city, which was sort of devoid of any kind of natural spaces. Maybe we would have a park area that was a designated green space, but outside of that, everything was very hard surface. And increasingly, we're trying to sort of blur the boundaries a little bit between the urban and the rural, and actually to really increase the quality as well as the quantity of the green and blue infrastructure in terms of its environmental functionality, things like biodiversity, but also creating habitats for improving human mental health and physical health, as well as improving the availability of urban biodiversity. There are lots of different ways that blue and green infrastructure can improve or can improve health outcomes for people in urban populations. And again, there's some specific reading on that, as well as the link on this slide. So something else that you will already be thinking about, you've mapped the existing transport infrastructure and the mobilities infrastructure for your areas, and you'll be thinking about how to develop maybe a healthy kind of transport infrastructure for your site proposal. So you could be thinking about that purely from a kind of transport perspective, a sustainable urban development perspective, but obviously there is also there are health benefits to certain kinds of modal choice, and there are health benefits to increasing the access to things like active travel, but also increasing people's use of public transport also increases active travel, because rather than walking from your front door to the driveway and getting in a car, even if you're catching the bus, the substantive distance of your journey, you'll be walking to the bus stop, or you may ride a bike to intersect with another form of mass transit. So those kinds of things are, in terms of networks and transport networks and modal choice, have a huge impact upon health outcomes. And it's one way that you can really start to, again, double count the kind of features of your proposal in terms of something that's benefiting purely from a sort of urban transport infrastructure sense, but also is hitting some really important targets around human health and well-being. Of course, one of the first things that people think about, if you sort of say, okay, how are you providing for human health and well-being on your site in terms of your proposal, most people think about locating certain kinds of medical facilities, so doctors, health centres, dentists, maybe even things like gyms and that kind of thing. So there is a kind of a preventative healthcare infrastructure in terms of the ways in which people can keep healthy on the site, but then there's also the sort of monitoring and treatment aspect of healthcare, which is, you know, the more traditional ways in which we think about healthcare. So not all of those will have to be located on your site. You can also think about how your site connects to existing healthcare infrastructure, but what do you want to have on your site? And this diagram here is kind of showing a little bit more about maybe some of the different scales and types of NHS healthcare provision that you could maybe think about. But again, it's that kind of, it is about thinking you don't have to provide for everything on your site, but what do you think it will be useful and necessary to have on site, but also how can you connect to that wider healthcare infrastructure outside of your site? So for the last few minutes of this presentation, I just want to talk in a little bit more detail about food and health networks, because this is really an area that is kind of closer to my research specialism. So I'm really interested in food security in urban areas and thinking about kind of wider food systems in terms of helping to improve health outcomes. So the image here is from one of the case studies that is included in the literature, again from this week, that I put in the learning materials. So Schilderswijk in the Netherlands, and I'll talk a little bit more about this case study in a few slides. So when you were thinking about food and health networks, it's not always a case of showing something visually on your site. So a little bit like the kind of healthcare infrastructure, you're maybe thinking a little bit more conceptually and a little bit more in terms of linkages and networks outside of your site, and what's in terms of what's available in the surrounding area, and also and how your site and how the people who live and work on your site connect to those wider infrastructures. So food and health networks can be a little bit more of a kind of a conceptual approach rather than simply putting different sites on your proposal that will meet certain needs. So there's lots of theory, and again, I've included some specific reading around this in the learning materials about the kind of what a healthy food infrastructure and health network looks like in an area, and that's really to do with thinking about food provisioning, so the different ways in which people access healthy food, affordable food, the role that food plays in the kind of socio-cultural health of an area, as well as purely in terms of sort of dietary and nutritional health. Food health links very much to these kind of broader concepts of environmental health as well. So while we are trying to address human health through improving our food systems, it's also necessary to improve our food systems from an environmental perspective. And quite a lot of cities now are starting to look at how they can reconnect urban food consumers to the more sort of productive regions in the urban hinterland. So it's not about transforming urban areas into sites of food production. It can be about introducing examples of food production into urban areas, but it's also about reconnecting urban consumers with rural producers, so that there is a greater diversity in the food system, and there's a greater awareness of the pressures of the food production system by urban consumers. So urban food strategies are a way of addressing this, and they often look at, they don't just look at kind of food provisioning. They tend to have quite a broad range of targets, so include things like public health, land use planning, issues to do with sustainable development, so how are we actually transform land use in order to improve food systems, and sort of transformation of city spaces and introducing new aspects to the economy. So that can be things like, you know, farmers markets or local food fairs. So these food strategies are quite broad, and sometimes they're a bit too broad to be really effective, but they do have some really interesting ideas in there in terms of case studies for how you can start to develop a healthier local food network. And again, this is from the source by Roberta Sanino, which is in the guided reading for this week. So integrating food systems into urban planning is a challenge. It's not something that you're going to be doing substantially in this piece of work, but it's something for you to have a think about, you know, drawing maybe some examples into your case studies, but this is really to sort of think about this as a bigger issue. So I've included a source by Cabanes and Morocchino, and that is looking at this issue of integrating food into urban planning. What I think is interesting about this text, and what I would invite you to explore, is there are lots and lots of case studies here, and they're global case studies. So they're not just case studies from the developed north, global north. They are global in their reach. And whilst it might be a big stretch to think about how some of these things relate to the context of the Netherlands or Hull, I think we're in a situation now where we aren't just looking, we need to look globally to countries that have not gone through the same level of industrial food system transformation that we have. Um, and get ideas really for how we can develop healthier food networks by looking at countries that retained a healthier food infrastructure and didn't go down the path of moving to sort of big supermarkets and multinationals dominating. So it can take a bit of a creative leap, but if you look at examples from global examples from all areas of the world, South America, from African and the Indian subcontinent, we can see actually examples of how urban food strategies there that are addressing very different contexts, but actually have some really interesting ideas and things that we could really learn from in terms of returning to something healthier rather than just looking to do something completely new that no one's ever tried before. So when you are thinking about a food and health network, and here's a very complicated diagram of a food and health network, I invite you to think about issues of scale. So again, you're not looking at how you produce all the food for the population of your site on site. You're looking at where within the sort of wider food networks and production networks, distribution networks, you can kind of tap into, and how you can link your site to those wider systems. So think about sites of production, processing, acquisition, and consumption in relation to food. So if you want to incorporate some aspects of food into your site directly, then is it which of these four is it, or is it something that incorporates a number of them? Are you looking to produce food, grow food on your site somewhere? Are you looking to incorporate some aspect of food processing or some distribution, community kitchens, that kind of thing, market spaces, that kind of thing? Think about how interventions around food networks can enhance opportunities and remove threats to health. And that really, again, returns back to the sort of opening slides of the presentation, which is understanding those sort of social, cultural, economic determinants of health. So what do we know is problematic around people's dietary choices and the access and availability of food in the area, and how can we incorporate things into the sites that will help to overcome some of those things? I again would invite you to think laterally and generously when you're thinking about how you can incorporate aspects of food into conceptual and spatial planning. It's not going to be something as straightforward as, it might be nice to have a community allotment, but what is a community allotment actually going to do in terms of food provisioning? Is it going to it's not going to grow all the food that everyone needs to eat. So what is it there to do, and how actually could you maybe do something that was going to bring a wider range of food provisioning into the area in a slightly more creative way? I just want to introduce very briefly this case study. You can go and read about it in the Born and Villion text that I've included in the week's reading. It's a case study called Barrierhöver, and it's the map here that you can see is this idea of a foodscape concept. And I think it's got some really interesting ideas. So this spatial diagram is actually just about food and health networks. What they have mapped here is not only places that you could grow food, so available land, but they've also mapped things like underused facilities. So there are spaces here where you could potentially grow food. There are spaces here where you could potentially process food and produce food that community could eat. So things like underused kitchens, school kitchens that aren't being used in the holidays and the evenings, spaces for potential markets to take place. But also kind of they've gone beyond that even into sort of mapping the kind of social infrastructure in terms of the sort of human capital. So how could they use the skills and competencies and capacity of the people in the neighbourhood, as well as the kind of spatial facilities and services in the area. So this is a really holistic and comprehensive way of thinking about a food network. So where could you grow food? Where could that food maybe be cooked, but also where could you bring in food from the local area in terms of processing, redistributing it through market spaces and that kind of thing. So it's a really nice, go and have a look at it in a bit more detail in the text, but it's a really nice kind of idea about how you can think quite broadly and quite conceptually about a food and health network in a spatial way. So again, what they mapped on here, and these are things to think about, is the green space networks. So how green space networks that you're already thinking about developing, how they could maybe incorporate an aspect of food provisioning, or how they could be, how you could think about them in terms of areas that are providing a health benefit for the population, how you can think about movement patterns in terms of the health benefits of movement patterns, as well as how easy it is to navigate the site and how easy it is to get to places outside of the site as well. Have a think about the importance of things like social cohesion to broader health. So one of the things that causes quite a lot of stress and anxiety within neighbourhoods is the areas where you have high crime rates or high levels of antisocial behaviour, and that's often an indicator of a lack of social cohesion. So if you have a good, strong community infrastructure, then there are wider benefits in terms of people's health and well-being. You could also think about, very kind of literal elements that are about food provisioning. So spaces of production, spaces of food processing, and spaces of food consumption. So there are a few of the references, again, those map to the ones that I've included in the guided reading. And we can talk about those more in the seminars and in class. So thanks very much.